Dr. Harry discusses the book Hijacking the Brain, which reveals how drugs and alcohol change the structure of the brain. He stresses the importance of early intervention in the course of the addiction to help the patient find their way back to their life.
Hijacking the brain refers to the phenomena of drugs and alcohol supplanting our natural survival prerogatives, making literally drugs and alcohol more important than food, more important than sex, more important than the air we breathe. And unless the hijacked brain gets the substance that it is identifying as necessary now for their survival, the withdrawal symptoms that one goes through are extraordinarily painful. It is specifically that phenomenon of hijacking that makes it imperative that we intervene on that patient as early in the course of their disease as possible. It's a progressive disease. It only gets worse. Postponing, procrastination, putting it off in any way worsens the problem and lessens the chances for successful treatment. It always increases the chances for other adverse outcomes.
Dr. Harry introduces us to Jane, whose life had led to a very dark place.
A few people I respect as much as Jane. She's really turned her life into one that has spread joy and happiness to thousands of people that she's counseled as one of the best addiction counselors I know.
It started in, I guess I was in my very early teens, but I came from a family where there was a lot of drinking and it was very normalized. I lost my family, I lost my education, I lost my health, and I was in a really bad place, suicidal, I would say. And people had been telling me, to do something about it, and I reached out that day because I just couldn't do anymore. I knew I was going to die, and I think I had made a decision that I wanted to live. After recovery, I met a lot of people that really encouraged me and showed me kind of how to begin living in a different way. I started going to college. I wound up getting a PhD. Now I've spent the last 35 years of my life at least doing therapy. But I got married. My life's good. My life has been a joy. I'm so glad I decided to live that day.
Dr. Harry summarizes how a diagnosis is made to determine the best treatment plan for each patient.
The gold standard for professional diagnosis is called the clinical diagnostic evaluation. That's a group of professionals that come together with a single patient. Usually involves a history and physical examination, an addiction survey or addiction medicine evaluation, a psychological evaluation, and psychiatric evaluation. Usually there's also psychometric testing, which tells us what the patient's cognitive abilities are, whether they've been adversely affected by a substance or by aging or some other process. Once that diagnosis is made by the team of experts, it's produced in a document that then is presented to the patient with very specific and evidence-based, it's always about evidence-based, treatment recommendations. And everyone should have a professional diagnosis. This deserves the professional training and opinion that a brain disease deserves.
Dr. Harry talks about the parallels between addictions and mental disorders.
Because substance use disorders, chemical addictions, are located in the brain, then they are intricately tied together with mental disorders. Sometimes the mental disorder is substance-induced. Alcohol is notorious for causing depressions, for example. When the substance is removed, that diagnosis may disappear, but about 37% of the people with an alcohol use disorder have a concomitant mental, usually mood disorder. And that goes up to about 57% when you're talking about drugs. and they go hand in hand. Both must be treated to be successful.